Hey everyone, Dr. Eric here. Let me ask you a question. Did you ever wonder what the difference is between dementia and Alzheimer's disease? Well, if you did, this is the show for you. I had today the greatest of all time, Dr. James Galvin, when it comes to neurology and brain health. And he answers this question on today's episode. Are you ready? Follow us. You know, speaking about caregivers, speaking about listening to stories, the folks who are listening today, I'm sure they are very interested in learning about this disease. And we're going to hit a couple of important topics. The first topic is this. We'll start very simple. Families hear the word dementia, and then they're like, oh, it's Alzheimer's. What's the difference? Is it Alzheimer's? Is it dementia? What's the difference between the two? And why is it important to actually know the different dementias that are out there and what you actually have? Is there a difference from a clinical perspective, from a treatment perspective? Or is it just, oh, I have dementia, that's it, that's what the doctor said?
Right. That's a great question. So the first thing to take away from this is dementia is really a general term. It's describing a change in someone's memory or other thinking abilities that interferes with their everyday activities. That's the definition. There are over 150 different causes of dementia, and each of those have different reasons why they develop. Some of them are genetic and some of them are not. Mm-hmm. Some of them are reversible and some of them are not. Some of them progress fast and some progress slow. So it's very, very important to know what the cause of the dementia is. So Alzheimer's disease is the most common cause of dementia, but it's not the only cause. Mm-hmm. So all Alzheimer's is dementia, but not all dementia is Alzheimer's. And so when I'm describing this, I often look at the audience that I'm talking to, mm-hmm. and I ask them, how many people own a car? Everybody raises their hand, and I say, well, what kind of car do you drive? And I'm trying, someone will say a Mercedes, and someone will say a Toyota, and someone will say a Ford, and so a Ford, a Mercedes, and a Toyota are all cars, but they're very, very different cars, right? And so it's the same thing. It's like the general word is describing the problem, but that's not a diagnosis. No one should be diagnosed with dementia because it's really just a collection of symptoms, right? What they should be diagnosed is what the cause of those symptoms are, because that then helps the clinician choose the right path for treatment.
It's kind of like, I like your car example because, for example, if I'm driving a Tesla, that's a car, and you're driving a regular gas car like a Mercedes or a Sentra, the fix-up for that when things go wrong is very, very different. The oil change, one doesn't have an oil change, the other needs an oil change.
Right. No, absolutely.
So it's important to know. So we know that it's important to know, okay, you have dementia, what type of dementia? Here's an incredible statistics, and I know remind me, are you on the board of the Alzheimer's or involved with the Alzheimer's Association?
Yes. Yeah, I sit on the board for the Southeast chapter, right.
So I know that's what I'm asking. An article came out from the Alzheimer's Association and it hit me, and I'm like, wow. It said that 40% of clinicians, providers, doctors, nurse practitioners say that they don't feel comfortable or lack the tools of making a dementia diagnosis. So, for example, in the state of Florida, we say that we have 720,000 people that we assume have Alzheimer's disease alone. Not just dementia, but Alzheimer's. Mm-hmm. If 40% of folks say, well, we don't feel comfortable making the diagnosis, is it really 720,000 that have Alzheimer's, or is it a lot more? So the question that the audience wants to know, I go to my PCP, I go to my neurologist, I go to somebody. What's the criteria? What are the steps? What entails being diagnosed that I have a dementia? Not the specific one, but at least saying I have a dementia.
Yeah. So, I think that's a great question. So there's a couple different approaches, right? So one, the patient may discuss with the provider, that they're noticing some changes in their memory. Mm-hmm. And they may or may not be good historians, because people who have memory problems may not be the best storytellers about what's happening. The spouse or family member may talk to the doctor about the changes they're noticing, or the provider may notice. So you have someone you've been treating for diabetes, and now their diabetes is less controlled because they're not able to keep track of that regimen, and they're missing medications, and they're not following the guidelines, and their hemoglobin A1C goes from like 5.9 is now at 6.3%, even though you've been treating them. And so there are three kind of things. The doctor may notice, the family may notice, the patient may notice, but then the doctor has to be in tuned with that, right? And it's really challenging to practice medicine today. You know this, right? There's a lot of burden with electronic health records. We're all on these, or almost all of us are on these relative value unit or RVU systems where it's just an assembly line, and you get 15 minutes with the patient or 20 minutes with the patient, and then there's 100 people in the waiting room and you have to get through them. So it's very difficult to figure out how to address these things. But a smart customer is the best consumer, right? And so a patient who's coming in and can get that information to the provider, that can trigger the provider to take the next action. And that could be during this visit, or they could schedule a follow-up visit to specifically address the problem. Because what often happens is you're finishing up with the visit and the patient says, oh, by the way, and I don't have any more time to spend with you. So the next thing was, well, let's get you back in a week or 2 weeks and let's get this worked out, right? So patient can complain, the family can complain, or the clinician can notice the changes because the patient's different than they used to be.
So notice the changes, so the complaint. So that's kind of like step one. A lot of the times when folks go to the doctor's office, and when a doctor may feel, or a clinician may feel uncomfortable making the diagnosis because the statistics, 40%, very often they say, oh, it's just normal aging. And so what tests would one have to do? Is it, I know back in the day we had spinal taps and all this other stuff. What is the first step that one would do in the algorithm of that workup to start working someone up for dementia? Right. Hey everyone, Dr. Eric here from MedBetterHealth. Now, if you got value from this video, I want you to imagine a world where caring for your loved one with dementia doesn't mean doing it alone. Imagine a world where you can have someone to help you at home taking care of your loved one. And imagine a world where you have 24/7 access to support when you need it. Well, I got good news for you. You don't have to imagine it anymore. This is now a reality, and it is now covered by Medicare. If you're interested in learning more, very, very simple. I want you to look up over here. We have our link to our website. Visit our website, scan our QR code, look in the description for the link as well, and don't imagine anymore. This is now a reality.